fraud means a net increase of $1 trillion in spending. Pipes 2020. Two sources of financing for Medicare for all. Existing public sources of funds will provide $1.8 trillion to finance Medicare for all. The remaining $1.05 trillion to fund Medicare for all will need it to be provided by new revenue sources. Financing Medicare for all will entail an overall level of funding that is nearly 10% lower than the funding requirements for the existing U.S. healthcare system. Because Medicare for all is able to operate at a funding level that is 9.6% below the current overall funding level for U.S. healthcare, it implies that on average, all households and private businesses will be able to pay into Medicare for all about 9.6% less than they are. Third, Medicare for all would cost $50 trillion by 2020. Medicare for all would add between $32.6 trillion and $38.8 trillion to the federal budget. Total cost to the federal government could run between $54.6 trillion and $60.7 trillion. Medicare for all would increase total federal spending by more than 55%. Doubling individual and corporate federal income tax will be insufficient to cover the cost of Medicare for all. To lend credibility to the $2 trillion savings number, one will have to argue that we can cut payments to providers by about 40% at the same time as increasing demand by about 11%. Reported administrative savings are unlikely to materialize. Other government agencies help administer Medicare. The IRS collects the taxes that fund it. The Department of Health and Human Services pitches in with office space and accounting help. The money those agencies spend help Medicare doesn't appear on the program's balance sheet. By necessity, the program devotes a much larger share of its expenses to medical claims than private insurer with a person of average health rank. This doesn't tell us whether Medicare is more efficient than private insurers. Medicare is beset by fraud. In 2017, the agency made $52 billion in improper payments. 7% of the program's total expenditures that year. Many of Medicare for All's supposed administrative savings will simply be offloaded onto providers. There are the costs associated with the destruction of private health insurance sector. J.I. Powell proposes setting aside up to 1% of our national health budget to assist these workers. That's billions of taxpayer dollars. The government will have to hire scores of employees to run Medicare for All. Single-payer advocates ignore the ugly fiscal history of federal health care programs. Medicare suffers mass cost overruns almost as soon as it launched in 1965. 2 years after Medicare opened for business, President Lyndon Johnson had promised in his State of the Union address that he'd tackle runaway medical price inflation. Fourth, single-payer costs. The McKenna Center study estimates that federal health expenditures under single-payer program will total $54.6 trillion. Current corporate and individual income tax rates will have more than double to pay off this proposed new spending. Moving on. High debt levels for the economy. Grant 2019. High debt levels will have serious consequences for the future of the U.S. economy. Debt levels are already reducing the rate of growth by more than 1 percentage point a year. How debt is currently hurting the economy. Growing empirical evidence shows that U.S. government debt has now been so large that it is having a significant effect on economic growth. This debt has been reducing annual growth since 2008. High debt level and economic decline is very hard for especially poor people, since because of this, they will get lower quality of life, which could lead to more deaths on their side. For taxation, taxes will increase. Pipes 2020. All Canadians face a 5% federal VAT. Many provinces have chosen to adopt some form of provincial sales tax, generally around 8%. In provinces with their own PST, the two taxes are blended into the harmonized sales tax, which usually amounts to 13% overall. New Brunswick and Newfoundland residents face a 15% VAT. Great Britain has broadly higher income tax than the US. A Canadian province forces at least some of its residents to pay double-digit income tax rates. Taxes made up of just 26% of the US GDP. In Canada and the US and the UK, taxes account for more than 35% of GDP.